Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forensic Medicine. In today's video, I will discuss about removal of ingested poisons, which is the commonest mode where the person consumes the poison. In that, there are two methods. Usually, it includes the gastric lavage and emetics, where any unabsorbed poison is removed from these methods. Coming to gastric lavage, it is usually any time within 2 hours after ingestion of poison. So, within that time, the poison will be still be present in the stomach. It is done using stomach tube, which is also called as Eva's tube or Bova's tube, or any ordinary soft non-collapsible rubber tube can also be used if the stomach Eva's tube is not present in case of emergency. The Eva's tube or Bova's tube, it is about 1 centimeter in diameter and 1.5 meter in length, with the funnel attached in one end and about 50 centimeter mark from the other end, and which is rounded and with lateral openings are present to avoid any injuries when it is passed. So we have the middle midpoint. There is also stomach suction tube bulb, which is used to pump the stomach contents. Other than that, there is also a wooden gag or a plastic gag which has a hole at the midpoint which allows the passage of the tube through it. One end of the gag is pointed, so one end of the point is tapered, so it can be forcefully inserted by the side of the mouth in non-cooperative patients. Coming to procedure of doing gastric lavage, first the dentures must be removed if the patient has dentures, and mouth gag is forcefully inserted into the position in between the teeth of the two jaws so that the teeth do not bite the tube. Care should be taken in case of unconscious patients, so there is a chances that stomach contents may be regurgitated, aspirated into the larynx, and the person may die because of asphyxia. Next, patient should be kept in the lying on the left side or a prone position with the head lying over the head. Head should be lying over the edge of the body. So if the body is present, then the head should be at the lower end of the lower end of the bed and face down, supported by the assistant. So the sub assistant should support the head. So the mouth is at the lower level than the larynx, so that any fluid which may leak through the sides of the tube do not trickle down inside the larynx and trachea. Next, the end is lubricated with olive or sweet oil or any liquid paraffin or glycerin and is passed into stomach by depressing the tongue or by through finger or by tongue depressor, and slowly passing through downwards through the pharynx and esophagus into stomach till 50 centimeter mark is reached. If in case of emergencies, like if any non-collapsible tube is used and if there are no mark is present, then tube should be passed to the distance equal to the measure between the bridge of the nose tip of the zipper process. So before starting the procedure, the tube should be measured, and between the bridge of the nose to the zipper process, and this mark should be made, and it should be inserted till that mark. Force must not be used to insert the tube, and any absence of respiratory sounds from the further indicates that the tube has entered the stomach. To test if it has entered stomach only, the free end of the tube is placed below the water surface. Usually, the bubbles starts appearing, and if the tube has entered the stomach, usually the air gets expelled within 2 to 3 expirations. Whereas if it has entered the lung, it causes burning at each expirations. At that time, the tube should be removed and again try to be inserted into the stomach. After that, 200 ml of warm water should be passed through the funnel, held high above the patient's head. So if the patient's head is present below the head, then the funnel should be placed above the head, and 250 ml of warm water is passed. When the funnel is empty, the tube is compressed between the thumb and finger and is lowered below the level of the stomach. So after the 250 ml is passed through the tube, then the tube is collapsed, then compressed, and the funnel is placed below the head, and the contents will be emptied by siphon action and releasing the pressure of the double tubing. So once the pressure is removed from this pressure by siphon action, the water will come out from the tube when the funnel is placed below the head. If the stomach pump is used, applying suction on the bulb will siphon the stomach contents. So stomach bulb is present, you can pump it, and because by that action the fluid content will come out. This first contents, so this is the first contents which comes from the stomach. This is preserved for chemical analysis and which will indicate what type of poison the person may have consumed. If there is any bleeding indication, the procedure should be abandoned, which indicates that there is a bleeding present in the stomach, and further process will exaggerate the bleeding. Gastric lavage may also be done with water. Other than water, other things can also be used, like 1 is to 5,000 potassium permanganate, 5% sodium bicarbonate, 4% tannic acid, 1% sodium potassium bicarbonate, 1 to 3% calcium lactate, saturated lime water or star solution of 0.9% saline. These are all used in certain poisoning where previously based on assumptions of certain poisoning, this can be used other than the water. In specific poisoning, these methods like sodium bicarbonate or potassium permanganate can be used. About 500 ml of suitable poison is used till no foul particle matter is seen and clear odorless fluid comes out. So this process of water and the any method fluid is used till any uh, particular matter is not present in the stomach contents and clear odorless fluid comes out. This indicates that there is no further interaction between the antidote and the poison. At this stage, stomach is not completely emptied, but a small amount of fluid containing the antidote, if specific poison is known, or activated charcoal suspension, which is 1 gram per kg body weight, or any catalytic is left behind the stomach so that it may neutralize whatever the small quantity of poison is left behind. Wright's tube or number 10 or 12 French catheter can be used for infants and children, and 25 centimeters is necessary to reach the stomach. In poisoning of salicylates, phenothiazines, Tyrex, antidepressants, antihistamines, lavage can be done up to 12 to 18 hours after ingestion of poisonings. Contraindication for gastric lavage: only absent contraindications are corrosive poisons like STI-SNO3 because they cause owing to the danger of perforation. Except carbolic acid, any corrosive poisoning is present, gastric lavage should not be done. In other conditions, it can be done by taking certain necessary precautions. Like one is convergent patients, as it may lead to convergence. Lavage should be done after controlling the convergence. In case of comatose patients, as I mentioned, unconscious comatose patients, the stomach contents may be aspirated, so risk of aspiration is present. So the endotracheal tube can be used to cuff endotracheal can be used to block the air passages. Then in case of volatile poisons, also in that case also the stomach contents may cause the volatile poison may be inhaled. In case of upper alimentary diseases like superviruses, it may cause the bleeding. In patients with marked hypothermia and hemorrhagic conditions also, there is a risk of bleeding. So in that case also gastric lavage should not be done and should be avoided. Complication of gastric lavage: there may be chance of laryngospasm, there may pneumonitis may occur, complication infection of lungs may occur, there may be chance of perforation of stomach, there is arrhythmias may also occur, and vagal inhibition person may also die because of that. Coming to next process of removing ingested poison, that is emetics. Emetics should be done only if there is a difficulty in obtaining or using a stomach tube. Vomiting can be produced only if there is a molecular centers are still responsive. Means if the person is still alive, person is if the person is molecular centers are still active, and in that case only it should be done. Usually ipecac powder about 1 to 2 grams or 30 ml of ipecac syrup powder is used, or 15 ml in case of 1 to 12 years, 10 ml in 9 to 12 months, and 5 ml for 6 to 9 months is used. Followed by several glasses of water induces vomiting in 90 to 95% of patients within 20 to 30 minutes of consumption. The dose is repeated if vomiting does not occur in half an hour. This is only and best method for producing vomiting. Other methods like using salt water, mustard powder, apomorphine, copper sulfate, tartaric acid are absolute, and they usually cause other complications. Some physicians also consider ipecac to be absolute and do not use it. Emetics are usually used before gastric lavage to remove any bulky food if there is a history of consumption of food. Emetics are given to remove food contents, then gastric lavage is started to remove the stomach contents. Contraindication of emetics: usually it is same as a stomach wash. Then several heart and lung disease also it is contraindicated. In case of advanced pregnancy, it is contraindicated, so it will be difficult. In case of if the person has consumed any serious stimulant, again stimulation by vomiting may produce convergence, so it is usually avoided. These are my references. Thank you.